Hi, this is Dr. Warren. I'm going to talk to you for just a few minutes about why exams in my office are a little bit different. We never hand patients a clipboard and say, please take your time and fill this out. We don't want to waste your time doing that. We talk to you, ask you questions, and find out why you're in the office, what your health status is like, what we can do for you today, and any questions or concerns you might have. We also use technology to enhance the exam process and the amount of information and information that I have about your eyes as you go through your examination. This aids in the accuracy in determining your prescription and in determining the health of your eyes. This information works together. I use it within our electronic health record and our refraction system to speed the process up and make things work better. It prevents us from having information lost or improperly entered when we enter data. It speeds up the process as we don't have to wait to set up devices. Everything is connected within the office. And this gets your information accurately and quickly into your electronic health record so I can create prescriptions, create care plans, create letters to send to your doctor, other things that happen automatically and accurately. I'm able to determine your prescription quickly and accurately because of the technology I use in my office. I have a super accurate starting point, so there's not a whole lot of refining we have to do. This makes the question and answer series or process much quicker and easier and less onerous for the patient. Before I even start your exam and come in the room to meet you, I've reviewed images and data about the front and back part of your eye, and I know how well your eye focus is light, what your prescription may be, and what we have for ocular health concerns to deal with. Then I examine your eyes. The other thing I do differently is I explain things. I like to make sure patients know what's going on with their eyes, their vision correction, what their vision correction options are, and what their ocular health status might be. It might be as simple as saying, your eyes are healthy. We don't have to worry about that. Or it could be explaining what cataracts are, how they impact your vision, what we're going to do about them, how your diabetes may affect your eyes, whether you have macular degeneration or glaucoma, those sort of things. Then we'll work together to protect your eyes and your vision and come up with a plan to manage any ocular disease you have and correct your vision as well as we can. Here's a quick example. This is a 45-year-old female patient of mine who wears soft contact lenses, doesn't wear bifocal lenses, she wears readers over the top. She has no history of eye disease, she just wears glasses and contacts to see well. This is some of the data that I review before I see the patient. This report has information about the corneal curvature under the axial power. It has information about how well the cornea focuses light. And it also tells me things about what the prescription might be like with different sizes of the pupil. When you take a look at this blow up of a portion of that report, you can see under SPH for sphere power that it goes from just under 8 units of correction up to almost 9. That's a significant shift, and this patient, before I even go in the exam room, I know that she's going to have an issue with her night vision. This is an example of the information I review about the back part of the eye. There's a photo of the eye. There are actually CAT scan type images done with a laser with different slits through the retina. And then there are thickness maps or data points across the whole back surface of the eye that tell me if the patient may or may not be developing glaucoma, if they have macular degeneration, all those sort of aspects. I review all this before I even go into the exam room. This is an example of the other eye. This is a patient who has normal ocular health. I know this before I even begin the physical exam. So she has a moderate increase in her prescriptions. Her pupil gets bigger, which is why she has poor night vision. She has much better vision with her contact lenses because the power in the lenses change across the surface of the lens to offset this, which is why her vision in her contacts is better than with her glasses. She has normal eye health, which I knew before I even started the physical exam. So we came up with a care plan. We're going to continue with her soft contact lenses with a small update to the power, and I discussed the reason for her poor night vision, which put her at ease knowing it wasn't due to a disease or cataracts or something else. We discussed her normal eye health, and the time from her exam from when she showed up in the office and started the process until we were done was 23 minutes. This patient was back to work in less than an hour, and that included the time it took to drive to the office, have the exam, and drive back to the office. If you want to experience this for yourself, give us a call. We'll be happy to schedule an appointment. I'm in most days of the week, and I'm in late on Wednesdays. Or you can visit our website to request an appointment. Thanks for taking the time to watch this short video. I hope to meet you soon.